Hey everybody, so great to be here with you again. I'm Leslyn Keith from the Lipedema Project and Lipedema Simplified, and I get together with you twice a month to talk about what's new in the research that pertains to lipedema. And let me tell you, I have quite a queue of papers. It is so exciting that there's so much research going into lipedema in just, I would say, in the last 3 to 5 years. It's astounding how many papers are coming out, how many people are, they're running studies. Sometimes it's just opinion pieces or a review to try to pull a bunch of information together, but there's just so much coming out, and I like to bring that information to you so you know what's new, what are the research updates that have value to someone with lipedema. So today I have the paper I'm going to be talking about today is called The Advanced Care Study, Current Status of Lipedema in Spain, a Descriptive Cross-Sectional Study. And so even though this was really looking at the situation in Spain, I think that we're pretty safe to extrapolate this out to people in general. They had a pretty good sample size that they looked at. And so let's talk about this paper a little bit, and I think it's going to have some meaning for you as well. So this was just published in August of 2023, and it was by 2 clinicians, researchers in Spain, and it was just published in the International Journal of Environmental Research and Public Health. So what was the purpose of this study? It was to assess the current state of lipedema in Spain, and they did this by survey, and they wanted to look at what are the symptoms that people were experiencing and what treatments have they utilized. They also wanted to look at what was the effectiveness of each of those treatments that the study participants used. And interestingly, another thing they added on to it, what was the impact of the lockdowns that were experienced in Spain because of the COVID crisis? And specifically, what was the impact on lipedema symptoms? So I thought this was a very interesting paper. And so this was a descriptive cross-sectional study. It analyzed online questionnaires. And so all the participants were recruited and online. It was 9 months over 2021 and 2022. This is when they gathered the data. And what they did is they went to the leading regional and national patient advocacy groups for lipedema in Spain. And then they got participants from that. And in order to be included in this study, you had to either be diagnosed, have an official diagnosis of lipedema, or you had to have at least 6 criteria of lipedema in order to be included if you were not diagnosed. The questionnaire itself had 46 items, so it was pretty extensive. It asked all the demographic information and medical history, family history, lipedema symptoms and the severity of the symptoms, and which treatments that they attempted and what was the results of each, what was the impact on quality of life of lipedema, and as I said, the impact of the COVID lockdowns. And they also asked questions about lipedema surgeries, if applicable. If they had the surgery, then they could answer those questions. So let's look at the participants. Like I said, they had a pretty good sample size. After weeding it down to make sure that the people met the inclusion and exclusion criteria, they ended up with 969 participants. So that was pretty good. 74% of those 969 actually had an official diagnosis of lipedema. The other 26%, they did not have a diagnosis, but they met the criteria for having at least 6 characteristics. And so they were then included in the study. So let's look at some of the results, some of the information that we got. And hi, Eileen, coming in from Puerto Rico. Thanks for posting. So they looked at weight, and this was calculated by their reported height and height and weight, and they got the BMI. And then, so they're using BMI, which is not the best for lipedema, but when you have BMI, you can very grossly put people into what we consider normal weight, overweight, and obese. And so in this study, by calculating the BMI, almost 39% were average weight, actually. And then overweight, 31%, and obese, 32%. So, and what was interesting when we relate it to just the characteristics of the general population of Spain, the authors reported that 63% of the participants were either overweight or obese, which is more than the general population of females in Spain, which is overweight and obese is 46%. So it was a little bit more for that population. Then they asked, when did it start? When was the onset of your lipedema symptoms? And this was pretty astounding. And I think it is really matching a lot of other papers that we're seeing. 73% said their symptoms started at puberty. They didn't report on people who said pregnancy, but the other one was menopause, and it was only 1.4% for menopause. So, but I thought this was pretty interesting that most people are noticing the difference starting at puberty. And then lipedema type. So remember, type describes where you have the lipedema fat deposited. And so I found this interesting that they have 4 types, and typically I'm seeing 5 types. So I'll let you know where the difference happens here. But most of the participants in the study were type 3 lipedema. That was 42%. And type 3 means the lipedema fat goes from the waist to the ankles. Then the next highest group are what they're calling type 4. And they said they call type 4 waist to ankles and the arms. And typically what I'm seeing is type 4 is just the arms, but type 4 typically will happen with other types of lipedema. And so, but they're putting that together, waist to ankles plus the arms, that was almost 37%. So that was the 2 largest groups. Then type 2, which is waist to knees, is 18%, and type 1, just the hips and buttocks, and that is just under 4%. So they don't have type 5, and type 5 is when we talk about that the most severe is in the lower legs of the calves. So they generally, this person will have lipedema fat from the waist to the ankles, but the calves are as big as the thighs or even bigger than the thighs. So that's where the worst of it is. And so I think that's a nice descriptor to be able to have that type 5 in there. But by how they did the types, that's where we were, mostly type 3 and type 4, which includes the arms. Comorbidities. So they looked at what was the respondents, what did they have as common other conditions along with their lipedema. And just over half of the participants had reported other comorbidities. That is not as much as I expected. Typically, you're going to have something, and they just over half, 52%, had other conditions. The most common second condition was obesity, 28%. And then we had hypothyroidism, low thyroid was 16%. And then lymphedema was 9%. Type 2 diabetes was less than 1%. So, and what the authors pointed out was, it was very interesting to note that the incidence of lymphedema in this population of patients with lipedema, it's 4 times higher than in the general population in Spain. So if you have lipedema, 4 times as likely to also have lymphedema, even though the overall incidence was just 9%. It was much higher than the general population. But on the opposite side, diabetes, 6 times lower than the incidence of the general population. So you're 6 times less likely to have diabetes and then the general population of Spain. Very interesting. So let's look at the symptoms that the participants said that they were experiencing in this population of just under 1,000 participants. The top 2 symptoms they talked about: number 1, feeling of heaviness and swollen legs. 94% of participants said that one. The next top one, just under 92% said they were non-responsive to diets. That is really interesting. So those are the top 2 symptoms. But then we still had a pretty high percentage of other symptoms as well. Tendency to bruise, just over 88%. Non-responsive to exercise, 86%. Having a disproportion between the upper body and the lower body, 83%. Pain on palpation, 83%. Nodules in the affected area, 76%. And spontaneous pain. So pain without any kind of cause that you could figure out, 56%. And so there was a lot of agreement in the symptoms, but I just thought that was amazing with the top 2 are in the 90s. That's unheard of for, these kind of surveys to have that much of agreement between the participants. And then next, the participants were asked about difficulties that they were experiencing due to lipedema. And this is interesting. The number 1 difficulty, 92%, difficulty finding clothing. And don't we hear about that a lot? Getting clothing to fit. And that when you have that disproportion, when that size of volume in your legs, getting clothes to fit was the biggest difficulty. And then the next one at 73% was restrictions in ability to perform certain activities. So a lot of people were having some kind of restriction in the activities that they could participate or perform. And I thought this was also interesting. 42% difficulty in socializing, which really points out the importance of community and having that a way to socialize when your lipedema is impacting you so much that you find it difficult to get out and socialize. Our tribe membership group allows you to do that online and still have that support in that community and to socialize. So that's an important need that we're addressing. So then getting a diagnosis. Now this was interesting, even though we had a majority, over 70% actually had a diagnosis. The difficulty for those 74% to get a diagnosis was quite arduous. So we had a majority who were able to get a diagnosis for lipedema. It required 3 or more visits to different specialists before they finally got a diagnosis. And that was 52% of that group. And the rest of them, so 48%, needed 5 or more specialists. That's a lot of going to doctors to get a diagnosis. So this really shows that we need to do better at that, helping people get a diagnosis earlier without having to go to so many doctors. Effect of the pandemic, effect of the COVID lockdowns. The number 1 effect was weight gain. So 64% of the participants said that they gained weight due to the lockdown. So that was, I'm sure there was lots of other things, but that was the main effect on their lipedema, was that weight gain. So then let's talk about diet. They did ask about diet, and they wanted to know, is this an intervention that has helped you with your lipedema? And how effective was it? And so 59% of the participants used some kind of prescribed diet to help manage their lipedema. And the two that they reported that worked the best, ketogenic and anti-inflammatory. Very interesting. And so 25% were using a ketogenic diet, and then the 17% were using an anti-inflammatory diet. And this they put as, interestingly, keto, protein, and gluten-free and dairy-free. So you can see there's lots of crossovers between ketogenic diet and anti-inflammatory diet, because that's also dairy, could be dairy-free easily, and it definitely is gluten-free. So that was interesting. And then what the participants called a healthy diet, and this was fruits, vegetables, and a Mediterranean style diet. And then last, they said other diets. So does that mean that they're not healthy? I don't know. But it said just under 10% were using either vegetarian, fasting, or low-calorie diets. So that's what made up the just under 60% of participants that were doing some kind of eating plan. So very interesting. And then how did they respond to the various treatments that they did? So interestingly, a combination of treatments gave the best results. So for instance, they got CDT and they wore compression garments and they exercised in the pool, or whatever the combination they did. Doing more than one and combining that gave them the best results. The next best result was doing surgery alone. Very interesting. So everybody said that an average of 75% or 75% of the time, the treatments gave them at least some benefit. Maybe not as much as they were hoping for, but 3/4 of the time they got at least some benefit. The two least effective treatments, I guess they gave them some choices of things to look at there, were something called radiofrequency and mesotherapy. And I'm just not familiar with either one of those treatments at all, but apparently they weren't, according to this population, these participants, not very effective. And then the top performing interventions after having a combination of treatments and then surgery next were CDT, complete decongestive therapy, compression socks, an anti-inflammatory diet, and low impact exercises. Very interesting. So, time to include some of those things if you're not already, because they might also really help you. So conclusions of this paper. The authors said that lipedema is a significant health problem in Spain. I think it probably is globally, and it really requires a multidisciplinary approach. We need help from many different healthcare providers. And they also conclude that the group that was diagnosed and the group that they allowed them to participate, because they had 6 characteristics of lipedema, the results for both of those groups was very, very similar. So they think that criteria of requiring at least 6 characteristics to participate in the study means that it's very likely that they probably have lipedema. So they thought that worked really well. And then they also said, from looking through this data, they said, wow, it is sure hard to get diagnosed, and we need to do better. We need to make sure that patients receive appropriate, timely treatment. So that means we got to do better at diagnosing lipedema to make sure that this is attainable for people. And I just really feel like this paper has a lot of importance for someone with lipedema, because it does show that there's a global impact. This is just in Spain, but I think this is probably likely that we're going to have these types of responses from around the world. And I think around the world, people are having difficulty getting diagnosed, even themselves becoming aware of the condition. But I think this is changing. I think we are doing better, but we're just not there yet. We need to do better about getting the awareness out and making sure that healthcare providers know about this and they can diagnose people. So I wanted to point out that I do this. I meet with you twice a month, but I also put these research updates on our flash briefings. So if you're not familiar with our flash briefings, that you can go to lipedema-simplified.org/flash, and you will see an archive of all of the flash briefings that we've done since 2020 or something like that is when we started doing them. They come out Monday through Friday. So check that out. Also, you can subscribe to those flash briefings. And then you can do that at Apple, Spotify, or Amazon Alexa. And you can subscribe there or at the website where I just told you at lipedema-simplified.org/flash. And then you can subscribe to it so you'll automatically get those flash briefings. They're just 10 to 15 minutes, like a really mini podcast that happens every morning. So, but go to that website also to check out all the archives of all the things we've talked about in the past. So that's another good place. You don't have to get everything by being here with me. You can also go to the flash briefing. So sign up for that if you can. And then I'm looking at the comments of what y'all are saying. And Marilee is here from the Pacific Northwest. And Eileen says she was stage 4+ is what she was diagnosed with. Lisa is in Iowa. Marilee says, what about the lower abdomen? It seems to be left out of the description. Yes, you are absolutely right. And this is controversial on whether or not lipedema occurs in other places besides the arms and the legs. I believe there is information out there that leads us to suspect that, yes, it happens particularly in the lower abdomen, but it might also happen in other parts of the body. But right now, the definition that is commonly used by practitioners and researchers does not include anything that happens in the trunk. But I do believe you're right, Marilee, that it could be happening there. We have submitted a paper for publication about the definition for lipedema, and this was a collaborative exercise with clinicians and researchers in Europe as well as in the US. And that group, we could all agree that it does happen in the arms and the legs, but there wasn't complete consensus that it happens in other parts of the body. But thank you for pointing that out, Marilee. And Doris says, been suffering with this disease since 1978, but was not diagnosed till 2021. Yes, I have read in the papers that people have sometimes wait 25 years, in your case, way more than 25 years to get a diagnosis. That's astounding, and we need to do better. So thank you for pointing that out, Doris. And Eileen says she's doing an anti-inflammatory diet and it's working out for her. She's also saying she's using a low impact exercises. Yeah, you're putting things together already. That's wonderful. Joyce says, I find it's easier to lose it in the lower abdomen than in the lower body and the arms. So wondering if that's why it's not included. Typically, lipedema has been non-responsive to diet and exercise, except in the trunk. But I wonder if it's truly lipedema tissue in that lower abdomen. Maybe it wouldn't respond to the typical weight loss diets either. But if you're using an anti-inflammatory diet or a ketogenic diet, then it would respond. And that's what we're finding anecdotally anyhow, and through 6 or more clinical trials with lipedema, that keto does work for anywhere you have lipedema tissue in your body, but it wouldn't respond to a typical diet. Eileen says, what about losing your hair? And that might be due to a comorbidity, or it could be due to trauma and stress. Not necessarily associated with lipedema, but it could be something some comorbidity like low thyroid and stuff like that occurs a lot with lipedema. So definitely something to discuss with your healthcare provider. So that was all wonderful. Thank you for joining me for talking about that. I want to talk about one more thing before I let you go for today, and that is that we're having our heart-to-heart virtual event coming up in October, end of this month, October 27, 28, 29. We'll have a link below for you to find out more. This is a collaborative, interactive event where you are participating. You're not just listening to what people are presenting, but you're participating and interacting with the experts, the speakers, the vendors, other participants. You get together and you participate. So check out that link below, find out more, and register and join us. So that's all for today. Thank you so much for joining me, and I look forward to talking to you again next